Today we will be talking about the penetrating keratoplasty procedure. This procedure is also known as a corneal transplant. The cornea is the clear outermost layer of the eye. Vision may be lost if the cornea becomes swollen, cloudy, or damaged from infection, trauma, disease, or aging. If the cornea does not heal, it needs to be removed surgically to improve vision. You can decide not to have the corneal transplant. If you don't have the surgery, your vision loss from the damaged cornea will remain and may continue to get worse. Patients with certain corneal conditions may be treated with eyeglasses, rigid gas-permeable corneal lenses, intrasomal corneal ring segments, or the Boston scleral lens prosthetic device. The choice of treatment depends on the type and severity of the corneal condition or disorder. In some patients, only the inner layer of the cornea or endothelium needs to be replaced. These patients can be treated with a different type of corneal transplant surgery known as Descemet's stripping endothelial keratoplasty or DSEK. The goal of a penetrating keratoplasty corneal transplant or PK corneal transplant is to improve vision caused by diseased or damaged cornea. However, a PK corneal transplant will not correct decreased vision caused by other eye conditions such as a cataract or glaucoma. The eye surgeon removes the 3 layers of damaged cornea by making a circle cut and replaces your damaged cornea with a donor cornea. This is kept in place by stitches, which are also called sutures. The PK corneal transplant can be combined with other eye surgeries such as cataract removal or glaucoma surgery if needed. The operation usually takes between 45 minutes and 1 hour. Risks of the surgery include infection, bleeding, swelling of the retina causing temporary or permanent blurring of vision, a retinal detachment, glaucoma or high pressure in the eye, rejection of the transplanted tissue, chronic swelling or inflammation, double vision, a droopy eyelid, loss of corneal clarity, poor vision, total loss of vision, or even loss of the eye. The rate of infection is reported to be between 5 and 15%, but this varies depending on the reason you need a transplant. Glaucoma can occur in up to 21% of patients after transplant. Transplant was successful in 82% of patients after 5 years. In extremely rare cases, transmission of infectious disease such as hepatitis, HIV, and syphilis can occur. However, the corneal donor is routinely tested for these diseases before the tissue is approved for transplant. Complications for the local anesthesia can occur, such as perforation of the eyeball, damage to the optic nerve, droopy eyelid, interference with the circulation of the blood vessels in the retina, respiratory depression, and hypotension. On rare occasions, useful vision can be permanently lost. The donor cornea is kept in place with sutures. These sutures can come loose, cause infections, or change the shape of the cornea. A change in corneal shape is called astigmatism and can cause blurry vision. Astigmatism may occur after PK corneal transplant. It can be treated with glasses most often, but in severe cases, contact lenses or more surgery may be needed. After the cornea is cut, it remains more delicate and can break open from trauma or injury. This can occur even several years after the surgery. It usually takes between 6 and 12 months for your vision to improve. Corneal transplants are successful 90% of the time. 8% of patients experience transplant rejection. If the surgery is not successful or the transplant is rejected, you will need another corneal transplant to see well. There is no guarantee that PK corneal transplant will improve your vision. As a result of the surgery or anesthesia, it is possible that your vision could become worse. In some cases, complications can occur weeks, months, or years later. Such complications may result in poor vision, total loss of vision, or rarely loss of the eye. You may need additional treatment or surgery to treat these complications. This additional treatment is not included in the fee for this procedure. Please discuss any questions you have with your doctor.